Present.
Present.
Present. Be it resolved that the confirmation to appoint the Board of Health Secretary, the Chair of the Board of Health, verbal report, the Medical Officer of Health, verbal report, the OPH Adapted Inspection Program approach, the Emergency Management at Ottawa Public Health annual update, the Board of Health Governance 2023 review and updates, the delegation of authority, contracts awarded for the period of July 1st to December 13, 2013, the 2023 operating and capital budget year-end results, Board of Health for the City of Ottawa Unit Status Report, the Ontario Ministry of Health Accountability and Reporting Requirements, Q3 and Q4 2023 Standard Activity Report, the attendance at Alpha AGM and conference, and the call for Board of Health nominations, Association of Local Public Health Agencies, Alpha Board of Directors be received and considered.
City of Ottawa Unit Status Report. Is this received? Thank you. Item 8.9, Ontario Ministry of Health Accountability and Reporting Requirements, Q3 and Q4 2023 Standard Activity Report. Is this received? Thank you. Item 8.10, attendance at Alpha AGM and conference. Is this received? Thank you. Item 8.11, call for Board of Health nominations, Association of Local Public Health Agencies, Alpha, Board of Directors. Is this received? Great, and thank you to Vice Chair for taking this on. Happy to have you on there. Okay, so we're going to go back to with the arrival of spring, I've noticed a renewed energy in the community as we can enjoy the outdoors and sunshine more. It was sunny today. I don't think it's sunny right now, but it was very sunny this morning. Without a doubt, this is good for both our mental and physical health to be able to do so. With the arrival of spring, we prepare to mark another National Mental Health Week, which is commemorated during the first week of May. This year marks the 73rd National Mental Health Week, and the theme is a call to be kind, which I love because compassion connects us all. Que ce soit sur le plan individuel ou collectif, nous avons toutes et tous la capacité de faire preuve de compassion et nous savons que cela peut faire toute la différence. Cette année, la Semaine de la santé mentale est axée sur le pouvoir de guérison de la compassion. Positive mental health is the core for a person's well-being, and each year, 1 in 5 Canadians experience a mental illness or mental health issue. And for many, accessing the right mental health care has been challenging. Ottawa Public Health works with care providers in the community and has many resources available to promote good mental health for our residents. We continue to work with OPH staff on our mandate to strengthen community mental health services and support progress-related policies and legislation at the provincial and federal levels of government. To build and maintain positive mental health, we must operate in a space that fosters more compassion, whether it's at work, at school, or in our day-to-day lives. Strong social connections help build our resilience, improve our physical and mental health, and help us cope with life stressors. Le conseil encourage les résidents à rencontrer une personne de confiance comment ils favorisent leur santé mentale. For information on when and where to access mental health supports, please visit ottawapublichealth.ca/mental health and wellness. Moving on to the provincial budget, last month the provincial government tabled its budget for 2024. It included some funding areas allocated to public health to address issues related to alcohol, public health supports for Indigenous and Northern communities, support for women's and children's health in remote communities, and vape prevention within our schools. Locally, we saw continued prioritization to support the development of the new civic campus of the Ottawa Hospital, maintaining supportive housing for Salus Ottawa, and the continued support of the Queensway Carleton's expanded mental health programs. Au conseil, il est important que nous continuions de collaborer pour enseigner tous les ordres de gouvernement sur nos priorités de santé publique et communautaire, afin de nous assurer d'avoir les ressources nécessaires pour servir la population d'Ottawa et d'être en mesure de le faire. Earlier this month, I was pleased to join Premier Ford and Mayor Sutcliffe as they announced that the City of Ottawa and the Province of Ontario have reached a new funding agreement for several important projects and initiatives throughout Ottawa. This includes new funding for affordable and supportive housing, downtown revitalization, and support for the Byward Market. This new agreement could provide funding for up to $543 million in operating and capital costs. Il s'agit d'une occasion de faire progresser de nombreux projets importants dans la ville. Nous resterons à l'affût des nouveautés ainsi que des occasions qui pourraient se présenter pour SPO. In addition to the new funding deal, Premier Ford announced Ontario will be providing Ottawa with an additional $37.5 million in funding through the Builder Faster Fund as a result of Ottawa making substantial progress towards its 2023 housing targets. Safe, affordable housing plays a key role in building a healthy community and a healthy city. It can help reduce health inequities and provides many of us, especially our most vulnerable residents, with the most basic and important supports to our health and well-being. I wish to thank Premier Ford for this important investment and congratulate Mayor Sutcliffe and my council colleagues for making continued substantial progress towards housing targets in previous years. Finally, I would like to close my verbal report this evening with a brief update on the Ministry of Health's 2023 initiative to support public health units to pursue mergers with other health units. Early in 2023, the Ottawa Board of Health participated in an education session to review the possibility of voluntary mergers with neighboring public health units, as requested by the Ministry of Health for all of Ontario's public health units. At our last meeting, the board passed a unanimous motion to maintain the existing governance, geographic boundaries, and service structure that currently exists within the City of Ottawa, noting that this scenario provides the best net benefits to the residents of Ottawa. Feasibility reports and business cases for those health units wishing to pursue a merger were due earlier this month. Throughout this process, I have continued to engage with members of neighboring boards of health to understand their plans on mergers. Of importance, we are aware of 2 proposal submissions in the East region. One merger proposal would be bringing together 3 units: the Leeds, Grenville, and Lanark District Health Unit, Kingston, Frontenac, Lennox, and Addington Public Health, and Hastings, Prince Edward Public Health. The second merger proposal is between the Boards of Health for Peterborough Public Health and Halliburton, Kawartha, Pine Ridge District Health Unit. Public health unit mergers will require provincial legislative change, and a merger will only occur if the province approves the submitted proposals. Until such a time, all health units will continue to operate independently. That concludes my verbal report. Do we have any questions? Seeing none, is this received? Great, thank you everyone. So 7.3, Medical Officer of Health, verbal report. Over to you, Dr. Etches.
Right, so good afternoon. Kwe, Unasuku, Tanche, Annie, bonjour. This evening's updates on initiatives underway at Ottawa Public Health will include the Ontario Spring COVID-19 vaccine campaign, routine immunizations, monitoring the impact of measles, and then I'll highlight the Chief Medical Officer of Health's report, the annual report from 2023, and our work with community partners on responding to substance use harms. I'm going to close with a few staffing announcements. Alors, le gouvernement provincial a lancé la campagne de vaccination printanière contre la COVID-19 plus tôt en avril, and that spring COVID-19 vaccine campaign that started in earlier April will continue through June. It is in alignment with the National Advisory Committee on Immunizations recommendations. And so Ottawa Public Health is recommending that individuals who are at increased risk of severe illness from COVID-19 receive an additional dose of the XBB COVID-19 vaccine in spring 2024. The individuals who are at higher risk include adults of age 65 and older, adult residents of long-term care homes, and other congregate living settings for seniors, individuals 6 months of age and older who are moderately to severely immunocompromised, and individuals who identify as First Nations, Inuit, and Métis, or and including their non-Indigenous household members who are 55 years and older. So in addition to our Spring 19 vaccination campaign, Ottawa Public Health is continuing to distribute rapid antigen test kits to libraries, to our neighborhood health and wellness hubs and other community clinics to improve access for high priority populations. And of course, we continue our respiratory surveillance dashboard. Regarding measles, reports of measles cases contracted during travel are coming. They continue to come from jurisdictions in Ontario, outside of Ottawa. Measles is highly contagious, and with childhood immunization rates dropping during the pandemic, there is a risk of transmission in our community. La vaccination est la meilleure façon de se prémunir contre la rougeole, car elle protège non seulement la personne qui reçoit le vaccin, mais aussi les autres qui sont dans l'impossibilité de le faire en raison de leur âge, d'une grossesse ou d'un état d'immunisation. So Ottawa Public Health, with Kids Come First partners, continue to offer the variety of childhood vaccines and an opportunity to speak with a public health nurse through our community clinics and our neighborhood health and wellness hubs. We're going to continue to collaborate to get those vaccines out, and I was really encouraged to hear from the team today. We are delivering more vaccines for these childhood immunizations out to primary care providers than we have been, so the demand is growing, and we're going to continue to support that. I would encourage you, je vous invite à visiter le site web de Santé publique Ottawa to check out our website to know more about how to protect yourself and your family. So the 2023 annual report from the Chief Medical Officer of Health for Ontario was recently released, and the theme of this year's report was to highlight the significant impact of substance use on Ontarians and its burden on public services like healthcare and law enforcement, including substantial financial costs. The report contains a great deal of useful information, so I highly recommend that board members take a look at that report, read it through, as well as anyone working to promote health and prevent substance use, anyone working in the field of mental health and substance use. Evidence-based strategies are recommended to reduce the potential harms of substance use through multi-sectoral combination of interventions, which include education, early prevention, harm reduction, treatment, and regulation. And the Chief MOH notes that we do need to continue to evolve our interventions as our context changes. Santé publique Ottawa continue nos travail concernant la santé liée à l'utilisation de substances. And our work to prevent substance use and to address substance use really continues under the standards related to healthy growth and development, school health, chronic disease prevention, injury prevention, our work with social determinants of health, and then our harm reduction standards. Within the report, the Chief MOH clearly states this is an all-of-society health-first issue, and while public health sector plays an important role, we're just one player. And so we're continuing, as Ottawa Public Health, to build those partnerships within the community to prevent and reduce harms related to tobacco, alcohol, cannabis, opioids, and other substances. One action since our last meeting is that we adopted an enhanced surveillance initiative with first responders, with our health and social service partners, reaching out more to businesses and community associations and residents as we saw the recent disruption to consumption and treatment services in our community, the local supervised consumption sites. We are continuing conversations about how to evolve these services and other health services and support City of Ottawa initiatives that could best promote and protect the health of people in neighborhoods with the greatest burden of illness. So in closing, I would like to announce the retirement of Dr. Brent Malachny publicly, that he's been, still is today, Ottawa's Deputy Medical Officer of Health, and his last day of work will be May 6th. Brent arrived not long before the COVID pandemic began. He stepped into the Deputy Medical Officer of Health role to facilitate the work of the Public Health Medicine Unit, and I think you can all remember during the peak of the pandemic, Brent was right beside me as a spokesperson for Ottawa Public Health through some of the hardest times, and maybe you didn't know, but he played just a critical role around the testing task force that involved so many partners, among other work. And he's had an over 30-year history in public health practice with other work before that, and so we're really thankful that Brent joined us for the last 4 years of this part of his working life. And we know, Brent, that contributions you've made will continue to last. The advice you've given, the way you always ask, what would success look like? These things will stay with us, and we really appreciate you. Wish you all the best. Et avec le prochain départ à la retraite du Dr. Malachny, nous avons le plaisir d'annoncer que le Dr. Trevor Arneson prendra sa relève comme médecin-chef adjoint en santé publique et va gérer l'unité de médecins de santé publique à compter le 13 mai cette année. And Trevor, who will join in the Deputy Medical Officer of Health role, has been an Associate Medical Officer of Health with Ottawa Public Health since 2019. He's played a key role in providing leadership and content expertise as the medical lead for vaccines throughout the COVID pandemic and more recently around childhood vaccination. He's also supported other OPH programmatic areas, including working with primary care providers, and he is actually himself a family physician as well, still in clinical practice, and he is going to resign from his role as the program director for the University of Ottawa's Public Health and Preventive Medicine residency program, so he can take on the full-time role as deputy. But he will continue to support learners, residents at Ottawa Public Health. So also, there's a few more announcements. Maybe we could clap for them all at the end, but please join me in welcoming Trevor. And therefore, the next piece is that I would confirm Andrew Hendricks is leading the Public Engagement and Legislative Affairs team on a temporary basis. Andrew has a great deal of experience on the senior leadership team. He was recently serving as the Director of Environmental Health and Infectious Diseases. And so today I was able to confirm that Andrew's role there will be backfilled by Dominic Bremner, who you will meet shortly. And really just will underline, clarify for you here that public health, the public engagement and the legislative affairs team members are going to continue as they are to support the whole organization, you, and so Andrew is your main point of contact for inquiries. And Dominique, do you want to recognize what she's bringing in terms of previous roles with Ottawa Public Health as a public health inspector, a program manager for infection prevention and control, and for safe food and water. She's been the manager of the environmental health branch and an incident manager for many enhanced responses. And so we really thank her for being willing to join the senior leadership team. So merci Andrew, Dominique, aussi Trevor. J'apprécie votre soutien. Et ceci conclut mon rapport verbal. So thank you, Miigwech. Merci. Happy to take questions.
Thank you, Dr. Etches, and congratulations, everyone who was mentioned. Do we have any questions? Go ahead, Member Banham.
I was just wondering if you could update any further on the measles spread, if we're seeing that kind of trend up, trend down, how the community is responding, et cetera.
Yes, so concerning measles, unfortunately, transmission in the world is still on the rise, including our neighbors to the south of the United States. We're seeing more outbreaks than usual, increasing number, more travel-related cases than usual being announced in Ontario. Here in Ottawa, we have perhaps with the latest coverage data from Public Health Ontario's vaccination coverage report, perhaps slightly higher coverage rates, vaccination in our population, but not where we want to be. So we really need 95% coverage rate to protect against measles since it's so transmissible. And so I think that's where we're really doing this work to make sure that there are opportunities for people to be vaccinated, especially young children, newborns as well, and that is, I think, important.
Thank you, Member Banham. Member Brown-Shrevs.
Thank you for the question around vaccination for COVID-19 this spring and where will people be able to get it. So it will continue to be available in pharmacies who have been giving the majority of COVID vaccines recently, as well as in our community clinics, as well as in our neighborhood health and wellness hubs. There are a few family physicians who are offering COVID vaccination as well. So I think across all of the normal channels, but again, Ottawa Public Health has a website to help people find COVID vaccines, and the details would be there in terms of the actual schedule of when in the neighborhood hubs that the dates might change, so they would be there as well as the dates for community clinics. Does that answer your question? So the neighborhood health and wellness hubs where it will be continued to be offered are the same hubs that we started in the neighborhoods that face the greatest barriers to vaccination. So that is part of the strategy. Did anyone want to add? I think, yeah. We have, so, you know, even hubs are situated in neighborhoods where we know there have been greater barriers. Even so, we know that's not always close enough. So I would say the other work that needs to happen and is happening is through our community engagement team and spreading the word through networks of partners who support people with maybe English or French isn't their first language. There's just other challenges to actually even make it to a hub. So we're trying to also continue to use those approaches that we used during the peak of the pandemic to continue to promote vaccination. Again, it's to the populations at highest risk for severe illness.
Thank you, Member Brown-Streves. Have any other questions for Dr. Edges? No? Seeing none, is this received? Great, thank you, everyone. Thank you, Dr. Etches. Okay, so we're gonna go to item 8.4, Ottawa Public Health Inspection, Adapted Inspection Program Approach, and we do have a presentation, so we'll just give a minute for staff to take their seats.
Great, thank you, Chair. Good evening. I'm Dominic Bremner, the Acting Director of the Environmental Health and Infectious Disease Service Area, and it is a privilege to be here this evening to present Ottawa Public Health's 2024 Adapted Inspection Program. J'ai le privilège d'être accompagné d'Anthony Grasse, qui est un de nos nombreux inspecteurs de la santé publique dévoués. Il travaille présentement sur l'équipe de prévention et de contrôle des infections. With this presentation, our goal is to offer you a comprehensive understanding of our program and our adapted approach for 2024. This approach prioritizes high-impact work, optimizes our resources, and emphasizes public safety to reduce health risks to Ottawa residents, all the while supporting Ottawa's business owners and operators. We aim to not only present our strategies, but also provide insight into the local and provincial challenges, rationale for our approach, and the opportunities we've identified. This report includes 3 recommendations to the board: to receive information on the 2024 inspection approach, to direct OPH staff to return to the board upon receipt of the updated Ontario Public Health Standards, and to request the Ministry of Health make a commitment to public health inspector profession by making funding of the public health inspector practicum programs permanent while committing to review the current funding formula. We are confident that these recommendations will further enhance public health inspector objectives and bring Ottawa Public Health closer to compliance with the provincial standards. Recognizing public health inspectors as the backbone of Ottawa Public Health's inspection program, I will now invite Anthony to provide an overview of the extensive and intriguing responsibilities of a public health inspector.
The natural environment hosts a diverse range of bacteria, viruses, pests, and parasites, while our built environment requires routine service, repair, and replacement. When food premises and swimming pools are not operated safely, and when equipment is not safely used, the public is put at risk of illness or injury, and those at higher risk may experience more severe outcomes. Public health inspectors inspect many different settings across the City of Ottawa, including restaurants, swimming pools, personal service settings, long-term care and retirement homes, and childcare centers. We educate operators and staff of these settings on public health regulations and best practices. When necessary, public health regulations are enforced with orders or fines. Public health inspections interrupt food handling that may make people sick and ensure personal service setting equipment is disinfected to prevent bloodborne infections. Ottawa Public Health is available for reports and complaints 24 hours a day, 7 days a week. Public health inspectors inspect and investigate behind the scenes, and our work is essential to maintaining the safety of many goods and services in our community.
Ottawa Public Health's inspection program is built on 3 fundamental pillars: surveillance, education, and inspections, which are rooted in evidence-based practices, continuous quality improvement, innovation, and principles of health equity, diversity, and inclusion. Ottawa Public Health's epidemiology and evidence team monitors reported illnesses and outbreaks, detecting emerging trends such as increased respiratory and enteric illness, and flagging these incidences to public health inspectors who can follow up with the facilities or clients experiencing illness to investigate the source. Despite a temporary decrease during the pandemic, rates of food and waterborne illnesses are rising again, necessitating ongoing education, surveillance, and intervention. We collaborate closely with various sectors, including food premise operators, retirement homes, and nail salons to ensure adherence to health standards. By providing tailored training and resources, we strengthen compliance and foster accountability across diverse sectors, enhancing public health. Some of this training includes public education campaigns, which can see our inspectors attending local events to teach residents about well water testing at our rural community fairs. Public health inspections ensure public safety and consumer confidence. Maintaining high standards through inspections can contribute to a thriving economy by promoting trust in local establishments and encouraging patronage. In 2023, Ottawa Public Health conducted over 11,000 inspections, including complaints and re-inspections. In response to our local challenges, we have embraced a tailored approach. This prioritization is based on factors such as population served, an establishment's history of noncompliance, and risk assessment. This approach allows us to determine the frequency and the priority of inspections for the subsequent year. For example, this year we will complete only one inspection of a moderate risk premise, such as a bakery, that has a history of good compliance instead of the mandated 2 inspections. As you will note on the slide, food premises are categorized as high, medium, and low risk. This classification is determined by various factors, including the population served, types of food handled, food handling steps, and the other relevant criteria. By applying this approach, we still plan to inspect the high-risk settings and those serving higher-risk residents in accordance with the standards. These settings would include long-term care and retirement homes, childcare settings, and settings offering services such as tattooing and piercing. Additionally, our program empowers us to leverage technology and implement cost-effective and innovative support for lower-risk premises to better address emerging challenges and improve our compliance. By focusing capacity on the highest risk inspections while reducing the frequency of inspections in some of our lower risk settings, it allows our team to increase services to equity-denied communities. The focus will enable Ottawa Public Health to gain deeper insights into compliance barriers. By collaborating with operators and owners, we aim to adapt as necessary and provide additional education and inspection support, ultimately fostering an environment where businesses can thrive.
Public health inspectors are certified professionals, requiring a degree followed by a 12-week practicum in the field before finally taking a board exam for certification. In Ontario, there are only 2 institutions offering the program, both located in Southern Ontario, posing challenges in recruiting and retaining public health inspectors in Ottawa. Every year, Ottawa Public Health seeks funding from the Ministry of Health to hire practicum students. This program allows us to showcase the City of Ottawa and Ottawa Public Health's work culture, which has led to permanent employment for over 30% of current staff and is a major source for recruiting. This funding, however, is temporary and often insufficient to hire more than 2 practicum students a year. Without this funding, Ottawa Public Health has limited opportunities to attract new public health inspectors to Ottawa from their main areas of study in Southern Ontario.
Ottawa Public Health is committed to prioritizing the well-being and professional growth of our staff, and we aim to build a resilient We will continue to work in collaboration with the City of Ottawa's Human Resource Department to enhance recruitment and retention strategies, but welcome additional supports from the Ontario Ministry of Health to address the unique recruitment challenges we see in this region. Further, Ottawa has a unique local context that has required an adapted inspection program. Ottawa has a geography bigger than many urban cities combined, resulting in public health inspectors having to cover larger areas than compared to urban public health units. Not only is our size and dynamic unique when it comes to rural and urban landscapes, but being the capital city also means that we're hosts to many special events throughout the year, leading to increased demands for inspections. As the population of Ottawa continues to grow, so does the number of facilities requiring inspection. We have seen an approximate 8% increase over the past 5 years. Beyond that, there are new and additional workload pressures, increased outbreak management, because of ongoing circulation of COVID-19, the number of outbreaks has nearly tripled compared to pre-pandemic levels. Also, Ottawa Public Health has observed that compared to pre-pandemic, inspections require more time to complete. This may be due to operator non-compliance and significant staff turnover in businesses, which resulted in a loss of knowledge and historical progress on best practices, and a negative impact on relationships with local owners and operators. We must remain flexible enough to respond promptly to urgent situations. Public health inspectors often play a significant role in emergency responses, including the pandemic and flood relief efforts. This past year, the Ministry of Health has started the review process for the Ontario Public Health Standards, including the protocols for safe food and water, infection prevention and control, and health hazards. As part of this process, Ottawa Public Health has actively participated in ministry-led review groups. During these consultations, suggestions were put forth for innovative approaches to rabies investigations and low-risk inspections, along with adjustments to the ministry's risk matrix used to determine frequency of inspection. Further consultation by the Ministry of Health is planned in the coming months. These reviews come at a crucial time for public health units across the province, as many others are also struggling to meet the frequency of mandated inspections. Je vous remercie pour votre attention ainsi que votre considération et nous vous invitons à nous faire part de vos commentaires ou vos questions, alors que nous continuerons à collaborer afin de continuer à protéger la santé et la sécurité des résidents d'Ottawa. Thank you.
Thank you very much. And we'll move along to questions. Member Gower.
Thanks for the presentation and thanks for the report. I was wondering if we have, I guess two parts to my question. Do we have the ability to charge organizations to make an inspection? And if we do staff have any thoughts on whether that would be a good or a bad idea, or would it be helpful at all?
Thank you for that question. I will refer part of it to legal in just a moment, but it has come up over the years. We've looked at fee for service, specifically as we were looking into facilities requiring many inspections, as well as special events. But because we are mandated, there is some limitation as to where we can go. But maybe just for legal to follow up on that question as well.
And there is a type of inspection that we charge for related to when there's been drug use in a facility. It's not food safety.
No.
But a health hazard inspection related.
Right.
So anyway, yeah.
I don't know if Rowan?
Yes, thank you. So speaking to the point of charging for inspections, the services we provide are mandated by the province, and so it doesn't leave us the ability typically to charge a fee for that. We wouldn't have a recourse. We're still required to perform an inspection, and so in that case, typically we wouldn't advise seeking to charge for reinspection.
Okay, thank you. I think the recommendations in front of us are good for now, but if we continue to have this gap between what we're legislated to do and what the funding we have, it might be something in the future that we consider, perhaps for not all situations, but for certain repeat inspections or certain categories. At the same time, I wouldn't want it to be a barrier, or I mean, I can see some downsides definitely as well. But if we end up where we're unable to perform what we need to do, we may have to look at some alternate ways to fund it. So thanks for the presentation. Thanks, Chair.
Thank you, Member Gower. Member Kavanagh.
Thank you very much, Chair. I was looking at where the graduates are coming from, and it's to the west of Ontario. Has there ever been any consideration to start up programs at Algonquin?
So we have started preliminary discussions with some of our post-secondary institutions locally. We would require working also with this certification, the SciFi, which is the institute that certifies our public health inspectors, because they would have to approve the program. And the academic institution would require the framework to be able to support, so an environmental health degree program at minimum, or at least within that scope of their practice, so we'd be able to leverage that, but we haven't gotten further than some of those initial conversations. But it is something we're looking to support, not only Ottawa Public Health, but regionally, as well as that bilingual aspect as well.
Yeah, that's what I was thinking. It's not just us. It's all of Eastern Ontario, and we know there's a number of places. So, even Kingston. I'd accept Kingston if there was something there. It just seemed really strange that it's evolved that way, and it puts a lot of pressure on especially since the program is difficult. The number of graduates are not that high. I don't know what else could be done in terms of helping graduates, like tutoring, you know, like, but to help them along, because obviously this is a really serious job shortage. That, I mean, the reason things like pandemics happen is when we don't have proper framework in place. So anyway, I hope that that can be considered for training more. Thank you.
Thank you.
Thank you, Member Kavanaugh. I actually had the same question, so maybe just a follow-up. I know the conversations have been very preliminary, but is there interest from our local educational institutions? Like, do they seem like that's something that they would be interested in?
I think some of the institutions that have the framework within, like Algonquin wouldn't necessarily have the framework to be able to pull this type of degree program together. But I think there's interest. I think we just need to help facilitate that conversation with Sci-Fi directly.
Okay, thank you. Thank you, Member Kavanaugh. That's your questions? Okay. Vice Chair.
Because I think you really thought through the mitigation here. Seeking out that many, I suppose, public health units are in this similar piece, looking at surveillance, implementing a tiered approach for risk mitigation. So I think we find ourselves in this place, and so keen to understand what will happen provincially, both to help with health human resources and also around the standards and sort of applying the evidence there. But I really didn't think it was a thorough risk mitigation plan, and so wanted to commend staff for putting them together.
Thank you.
Thank you, Vice Chair Giuliani. Member Bauer, please.
Thank you, Chair. And I would just echo the comments and questions from previous members around the need for a regional training hub. Was wondering myself if that could be built into our recommendations to the ministry, in fact, for them to support. I learned a lot through the presentation, the briefing notes. It's one of those areas of public health that perhaps is more under the surface, but critical, and very much appreciated the background materials, as well as the risk analysis at the end of the briefing note. I would echo the Vice Chair's comments on the thoroughness of the risk mitigation. I struggled overall to understand if we were moving up the risk register overall, in our opinion, with the adapted program this year. So would be interested in your thoughts on that. Are we onboarding a higher likelihood and impact overall with the adapted program? Or are we confident that the mitigation measures are keeping us at the same level of risk as perhaps the previous year?
Thank you for your question. This is, I think, worth noting is our adapted inspection program we've been doing for some years, especially through the COVID pandemic. We've had to prioritize our inspections. We did an evaluation in 2023 specific to our food safety program, where it was noted that we have seen an increase in compliance, especially as it related to, and a decrease in critical infractions, which is a really good sign as associated with our actual adapted inspection program. So the evaluation is really supporting the adapted approach. We also do a lot of other work related to education. So we do spend a lot of time with the operators on site to provide that education, because as you'll note, an inspection is a point in time. So we can't assume that an inspection done, whether it's 3 times a year for high-risk settings, will be the only source of ensuring compliance and protecting the public. So we do need to really focus on education so that protection and that education and the best practices are adhered to all year round.
Thank you, that's helpful.
So I personally, my assessment is probably similar to last year. We have a little more capacity with a little less COVID, but we have pressures on us from growing populations, more businesses reopening. So maybe we're holding steady, but we're concerned about the future risk.
Thank you, Member Bauer. Member Bannon, please.
Thank you. I think my initial question has been answered, and it was about the locations of the schools. But one of the things I was really impressed about in this report was the focus on DEI and equity. And I think when we look at the schooling, specifically when we're talking about the Francophone population and there not being an education program for Francophone students, that does also present equity challenges for the people who are in the pipeline to be employed. And so I hope that if there are discussions moving forward with the school, that would be part of the conversation, is being able to apply both a Francophone and potentially an Indigenous lens to that programming.
Thank you.
Thank you, Member Banham. Next, Member King.
Thank you, Chair. And I just had just a quick question. I was just curious about the competitive pressure that's created with the lack of PHI candidates. So I was wondering if you could talk about what pressures that creates for compensation and attracting these candidates for employment in Ottawa.
Well, I think going back to the academic, the programs being in Southern Ontario, it does make it difficult. Even if we're able to recruit them, it's difficult to retain. So that's something that we're really focusing on as we have these discussions with academia. We are also working with our HR, our city HR counterparts in updating. There's different strategies with recruitment and retention, and we're currently updating the public health inspector job descriptions, which should support as well. We currently have a market rate adjustment for the inspectors to be competitive. So we are working on different strategies and really in support with the HR department.
I appreciate that. Thank you, Chair.
Great, thank you. Member Kavanaugh?
Yeah, I was just thinking in terms of replacing the current inspectors, what's the average age? I'm wondering, how close are we to having a lack of them because of retirements, et cetera?
That is a challenge. We've been seeing it over the pandemic as well, because there's been some additional pressures in how busy things have been. We have seen some retirements. As we're bringing on new staff, we're seeing attrition through retirement, so it is definitely playing a role. But we are really focusing on, that's why the public health inspector trainee program is so important, not only for ourselves, but also just getting the certified public health inspectors into the workforce so that other health units are able to train them and be able to certify them in an appropriate manner.
And perhaps these ones that are retiring could be teachers, like that often happens with nursing and other professions.
Right, yeah. Thank you.
Okay, thanks.
Okay, thank you, everyone. I'm not seeing any more hands, but that was an interesting discussion, so thanks very much. So we have some recommendations here that the Board of Health for the City of Ottawa Health Unit, 1, receive information about Ottawa Public Health's Adapted Inspection Program for 2024 as outlined in this report and attached document 1. 2, and that the Board of Health direct staff to report back on the inspection program upon receiving the new Ontario Public Health Standards and Protocols. And 3, that the chair of the Board of Health send a letter to the Minister of Health requesting that the Ministry of Health institute permanent annual base funding for the Public Health Inspector Practicum program and convey the need to review the funding formula alongside the review of the OPHS to grow capacity for inspection. Is that carried? Carried. Great. Thanks, everyone. Okay. Thank you. We will move along to the next held item, 8.5, Emergency Management at Ottawa Public Health Annual Update. Member Bauer, I believe you had questions.
Thank you, Chair. Very much appreciate the update. It was very comprehensive, covered a wide range of issues. I was just wondering, I mean, the short question is, what is keeping us up at night in terms of the issues outlined? I guess the longer question is, given the range of issues and sort of applying strategic foresight and sort of the evolution of trends, what is sort of our top of mind concerns? We've had recent reports from the federal government and provincial governments about wildfire risks. I don't know if that's sort of jumping to the top or not, but there are others sort of mentioned at the end of the report, so be interested in views around that.
Thank you for the question. I'll try to speak on behalf of the team, but I'll also invite Andrew to speak, or Denise, actually. I think Denise could be brought online. Denise would be most familiar with the top 10 hazard identification and risk analysis HIRA list that the city has approved as the top 10 most likely things to be concerned about. Some of them are easier to mitigate than others. So what we talk about quite often, certainly we would agree with the World Health Organization that climate change is the biggest risk to human health that we're facing. And how that can be felt here certainly would be concerns related to heat-related illness. In that regard, what keeps me up at night is that we do have quite a few isolated older adults with low income who don't have access to air conditioning. We are working with the city to try to mitigate the potential for harms there through fostering social connections and support. There's complexity in terms of trying to create bylaws or something that would mandate air conditioning in buildings. You know, we're exploring different options. But I would say that's the top thing for me. And I think Andrew's maybe willing to add something.
Yeah, thank you for the question. So I was actually going to mention the same thing that Dr. Etches mentioned around climate change, and particularly around supporting priority populations and neighborhoods that need more support. So what Dr. Etches didn't mention is this is part of our strategic plan, right? So goal 2 within the strategic plan does talk about the different strategies that we're working on, not alone, but with city partners and with external partners, and emergency management is a strong component of that of that strategy and parts of that strategy. So.
Thank you, Member Bauer. Vice Chair Giudiamani.
Sure. I think probably a quick question, but I did notice that we were moving from an IMS framework to an incident command framework, and my understanding is that IMS was across province, so just wondered about the rationale for that change and if that introduces any risk when we're working with other organizations in an emergency situation.
Yep, I can go ahead. Thank you for that question. So, yeah, it's the way that it was explained to me is it's a progression, right? So you can go from an IMS to an ICS, and in terms of training that's required for employees and staff, this would be a natural progression from one system to another. This is what the province is also moving towards, as well as what our City of Ottawa emergency management colleagues are doing as well. So we feel like this is welcome news. We feel like we're ready to take that next step into moving from an IMS to a ICS model.
Yeah, that's right. So there is a trend to shift. It is the case that some of our partners in the area are using a different system, and that has been deliberately thought through. So the policing approaches are different, but the interconnections between them, it shouldn't be difficult. And I think there is also discussion underway there about making a change when the time is right.
Great. Thank you, Vice Chair. Okay. I don't see any other questions. So is this item received? Great. Thank you. Okay, next. On to 8.7, Delegation of Authority, contract awarded for the period of July 1st to December 31st, 2023. Member Bauer.
Yeah, just a quick question on the eco survey contract. Just wondering if that's work that would typically come to the board.
Yes, I think again, not again, but Andrew just mentioned our strategy. So it would be part of how we're evaluating our work in terms of people's understanding of what Ottawa Public Health does and their opinions of our services and our programs. So we think this survey here is meant to be a baseline in some ways after the pandemic, before the full implementation of our strategy. We will bring that information to you, and then we would like to repeat it some years on to see how we're doing. And Andrew's working with the team. I think this is in the field as we speak. Also, our epidemiologists advised on the approach. And we're going further to try to get a more diverse participation using our networks of partners to make sure this opportunity to provide us with input is shared widely. So, anything else people want to add? No, that's fair.
Thank you.
Thank you. Not seeing any other questions, so is this item received?
Received.
Wonderful. Okay, speeding right along. We have no information previously distributed. Motion to adopt reports. Member Chung, please. Thank you. Is this carried? Wonderful. I don't believe we have any motions requiring suspension of the rules. Do we have any notices of motion? Seeing none. Okay. Hold on. I made a go back to which item?
Technical amendment for the delegation of authority.
Okay, there's a technical amendment for, my apologies, for item 8.7, delegation of authority, contract awarded for the period of July 1st to December 31st, 2023. Am I reading it?
Yes.
Okay. This whole part here? Okay. Whereas the delegation of authority contracts awarded for the period of July 1st to December 31st, 2023 report and the 2023 operating and capital budget year-end results, Board of Health for the City of Ottawa Unit Status Report, distributed to members of the Board of Health and posted on ottawa.ca and ottawapublichealth.ca, required the following revisions. In the report titled Delegation of Authority, Contracts Awarded for the Period of July 1st to December 31st, 2023, the background referenced an outdated way of reporting the delegation of authority period, which stated data based on purchase orders issued within the delegation of authority period. This paragraph was removed as the new procurement system, Aribia, provides the option to report the total expected expenditures of the contract, including optional years approved but not committed, which better aligns with the requirement of the City of Ottawa's purchasing bylaw. The report titled the 2023 Operating and Capital Budget Year-End Results, Board of Health for the City of Ottawa Unit Status Report, Table 1, Summary of 2023 Operating Year-End Results, contained a column titled Annual Planned Expenditures, which was removed as Annual Expenditures is already reported in the table. And whereas the delegation of authority contracts awarded for the period of July 1st to December 31st, 2023 report and the 2023 operating and capital budget year-end results Board of Health for the City of Ottawa unit status report have been circulated to members of the Board of Health ahead of tonight's meeting with these corrections. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit approve the report as amended by the revised, updated, the delegation of authority contracts awarded for the period of July 1st to December 31st, 2023 report, and the 2023 operating and capital budget year-end results, Board of Health for the City of Ottawa unit status report, and authorize the Board of Health Secretary to post the revised and updated the delegation of authority contracts awarded for the period of July 1st to December 31st, 2023 report, and the 2023 operating and capital budget year-end results, Board of Health for the City of Ottawa unit status report on ottawa.ca and ottawapublichealth.ca. Is that carried? Okay. And is the report received as amended? Great. Thank you. Sorry about that. Okay. We were at notice of motion. Seeing none, confirmation bylaw. Member Chung, please. Is that carried? Wonderful. Are there any inquiries? Seeing none, we will adjourn. Next meeting is Monday, June 17th. See you then. Thanks, everyone.